Hey everybody, it's Luke up here at Hayward Area Memorial Hospital in Water's Edge, and we are outside of a new rehab addition that is just about finished up. Seems like not too long ago we were out in the parking lot talking about all the dirt work going on up here, and now we almost have a finished product. So with me today is Al Bowman, the Director of Rehab Services. And so Al, tell me a little bit about what's going on in the exterior here.
Yeah, so I'm really excited because this new rehab facility has its own private parking lot and very convenient entrance for our patients. It's really planned out like its own standalone rehab facility.
So patients come for rehab, they don't really have to go into the hospital, they don't really have to interact with any of the other services, which creates a better experience for those rehab patients, but also creates a better experience for those patients that are using other hospital services as well.
Exactly.
Yeah.
Okay. We feel very fortunate that we have a nice, warm, welcoming environment now for patients. It doesn't have any type of institutional feel. It's a very exciting, upbeat rehab facility with a lot of staff that are excited to be in there.
Awesome. So let's go in, take a look inside, and see what the inside looks like. So Al, we're sitting in the new lobby of the rehab addition, and looks a lot different, feels a lot different than the old space. So tell me more about what we have going on here.
We have a great entrance with its own vestibule. We have a kiosk in the vestibule and also here in the rehab waiting room that highlights each of the providers and their different specialty areas. The waiting room is about 5 times the size of our current waiting room. We have a nice nutrition station with water and coffee and different tables for pediatrics and high tables for people with hip and back problems. So it's really laid out well, a lot of space for social distancing and extremely safe, and again, warm, friendly environment.
Awesome, yeah, feels really great, and unintended, you know, the fact that we have more space and we need more space to make sure that we're maintaining, you know, that 6 feet of space between patients to ensure their safety is timely, and so, yeah, thankfully that all happened when it did, and so great space. Feels really, really nice with all the natural light in here when you come in, and so what we'll do is we'll kind of dip back and take a look at some of the exam rooms back here as well. All right, so we are back in one of the new exam rooms in the rehab space, and a bit bigger, a bit more spacious. Even some of them have bathrooms attached for certain specialties that need that. So what can you say about, you know, some of these spaces and how they are going to change practice? And I guess the other thing I'd like to ask too is, you know, I think some patients are wondering, you know, is it really safe to come in right now, and should I be going in a healthcare facility if I'm high risk? And can you just talk about the screening process that our therapists are doing, as well as some options if I don't feel comfortable coming in?
Yeah, absolutely. So right now, all of the staff that come into the hospital do a screening process, and you can't come into the hospital without the screening every single day, every shift. And our patients also get screened for their temperature and any symptoms. So the people that come into the facility, we feel very comfortable that they're safe, and you also have to wear a mask here. And so this is probably one of the safest places in the community, and I feel very strongly that when people come here, that they are absolutely safe as possible. But if people don't have transportation, or if they have a lot of risk factors and comorbidities where they really shouldn't be here, they can do telehealth. And so we've set up a great system of telehealth using different video and audio. We can use Zoom if people don't have that capability at home. We can also do that over the phone. And basically, we are trying to provide a service that isn't available prior to COVID. And so I feel like it's a great option for people who don't have the ability to come in. And it's worked out really well.
We'll be doing updates on different areas of the rehab space and different team members over the next few days and coming weeks. And so keep an eye open for those. Thanks, Al, for your time. Looking forward to seeing all the great care that we're going to provide for the Hayward community in this new space. So until next time, we'll see you. And please be safe, be well, and keep an eye open for those rehab videos that we'll be posting.